A very good morning to all. This is Manyata Das of class 9, studying in St. Xavier's High School and Shivani Tutorial, here to present a PPT based on the novel coronavirus. The coronavirus prevention is better than cure. The COVID 19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health, food systems, and the world of work. The economic and social disruption caused by the pandemic is devastating. Tens of millions of people are at risk of falling into extreme poverty, while the number of undernourished people, currently estimated at nearly 690 million, could increase by up to 132 million by the end of the year. Here are the symptoms of COVID 19, which include fever, cough, shortness of breath or difficulty in breathing, fatigue, muscle or body aches, headache, new loss of taste, new loss of smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Here are the death rates. Although COVID 19 is seen as a disease that primarily affects the lungs, it can also damage many other organs, including the heart, kidneys, and the brain. Organ damage may lead to health complications that linger after COVID 19 illness. In some people, lasting health effects may include long term breathing problems, heart complications, chronic kidney impairment, and stroke. Some adults and children experience multisystem inflammatory syndrome after they have had COVID 19. Here is a graphical representation of all the death rates of all the major countries. So the major countries, they are the United States, Brazil, India, Mexico, Peru. These are the worst hit countries. Precautionary measures. So, prevent the spread of COVID 19, we must follow some measures which include maintain a safe distance from others, at least 1 meter, even if they don't appear to be sick. Wear a mask in public, especially indoors or when physical distancing is not possible. Choose open, well ventilated spaces over closed ones. Open a window if indoors. Clean your hands often. Use soap and water or an alcohol based hand rub. Get vaccinated when it's your turn. Follow local guidance about vaccination. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. Vaccines. A vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. A vaccine typically contains an agent that resembles a disease causing microorganism and is often made from weakened or killed forms of the microbe, its toxins, or one of its surface proteins. Here are the list of vaccines along with their manufacturers. First is Covaxin, manufactured by Bharat Biotech. Covishield, manufactured by AstraZeneca. Moderna, manufactured by Moderna. Novavax, manufactured by Novavax. Sputnik V, manufactured by Gamaleya Research Institute. Zydus Cadila, manufactured by Cadila. So India currently uses only three, that is Covishield, Covaxin by Indian firm Bharat Biotech, and Russian-made Sputnik V for its vaccination drive. Of this, Covishield accounts for over 90% of the doses given so far. Now, what are the effectiveness of vaccines? COVID 19 vaccines are safe and effective. You may have side effects after vaccination, but those are normal. It typically takes 2 weeks after you are fully vaccinated for the body to build particular protection against the virus that causes COVID 19. Getting vaccinated could save your life. COVID 19 vaccines provide strong protection against serious illness, hospitalization, and death. Vaccine effectiveness is a measure of how well vaccines work in the real world. The COVID 19 vaccines from Moderna and Pfizer save, provide about a 95% developing severe symptom from COVID 19 after completion of the two-dose series. The effectiveness of vaccines in the real world can differ from the efficacy measured in a trial because we can't predict exactly how effective vaccination will be. More a much bigger and more variable population getting vaccinated in more real life conditions. Vaccination of children. So now it comes towards the vaccination of children. So, vaccine helps prevent kids from getting COVID 19. Although COVID 19 in children is sometimes milder than in adults, some kids infected with the coronavirus can get severe lung infections, become very sick, and require hospitalization. This is especially important to remember in light of the Delta variant, which is more contagious than other coronavirus variants. The current vaccines are still effective in preventing severe illness from the Delta variant of the virus. Children can also have complications such as multisystem inflammatory syndrome in children that may require intensive care or long lasting symptoms that affect their health and well being. The virus can cause death in children, although this is rarer than for adults. The vaccine helps prevent or reduce the spread of COVID 19. Like adults, children can also transmit the coronavirus to others if they are infected, even when they have no symptoms. Getting the COVID 19 vaccine can protect the child and others, reducing the chance that they transmit the virus to others, including family members and friends who may be more susceptible to severe consequences of the infection. This is the conclusion part where I pay a tribute to all the frontline warriors. While on one hand, people across India and around the globe are largely confined to their homes with businesses and educational institutions all shut down in an attempt to contain the virus, and on the other hand, doctors, healthcare workers, and medical staff members are leading the battle against COVID 19 from the front, putting their own lives at risk with selfless determination for the sake of saving lives. They truly are our heroes in these challenging times. While they are putting their own health, families, and most importantly, their own lives at risk, the least we can do is appreciate their efforts and cooperate by staying safe indoors. That being said, it is good to see tributes pouring in for all the medical heroes working in scrubs. Every day, the selfless warriors are giving it their all in healthcare settings while cutting themselves off from their families and loved ones. The sacrifice that they are making for the safety and welfare of humanity is priceless and deserves lifelong gratitude on our end. The last thing which we all can do is to spread the social awareness. We are collectively facing a pandemic threat that is sweeping across the humanity beyond oceans and borders. Considering the seriousness of COVID 19, it's about time we step up against this deadly disease. For the sake of lives lost and the rest of humanity, let us all pledge to beat Corona back. Thank you.